Hello, everyone. My name is Joe Tibbs. I'm the president of HAPevolve, and today for our Solution Spotlight series, I am really fortunate to have Jon Michial Carter, who is the co-founder and chief growth officer for one of HAPevolve's endorsed partners, ChartSpan. Thank you so much for spending some time with me today.
Happy to be here, Joe. HAP is one of our most treasured and important partners, so it's a delight to be with you.
I love it. So, Jon Michial, can you just kind of give people who might not be super familiar with ChartSpan a high-level overview as far as who you are and what your company does?
Yeah, well, let's keep it simple and then I'll delve into the details. So, in a sentence, we provide proactive preventative care to Medicare patients. Our job is to identify patients who might have a chronic condition, but to prevent the exacerbation of that by predictably every month reaching out to them to make sure they're taking their meds, they're going to their appointments, that if they need transportation, it's our nurses' job to make sure that we lighten that load, lighten that burden, and keep them as healthy as possible.
I love that so much. Can you walk us through? I know there's some really great research that you're way more familiar with than I am around some of the effectiveness of some of these programs that ChartSpan kind of works with.
The data shows us last year when we look across our customers, the average benchmark for cost on a Medicare patient last year was $12,400 a year. When we got them into one of our care management programs, we reduced that cost by $2,454 a year. Now imagine you're taking on risk and you get some percentage, if not a majority of it, back through an ACO or a shared savings program. And what's really unique about these programs is that it's not just wondering how you'll perform in shared savings down the road. You get paid fee for service up front, and then the money that you save net goes back to you in the form of these MSSP or ACO programs. That's why these programs are resonating with so many practices and health systems around Pennsylvania.
Can you speak to some of the things that you've seen in terms of the clinical outcomes and the patient outcomes as organizations have adopted your programs?
Let's talk about the patients first. Specifically, we do focus groups with patients. The number one reason patients enroll in these programs and the number one reason they stay in it is immediate, real-time access to a nurse within seconds. Now, you know what happens if you call your practice this afternoon, you might get a phone call tomorrow.
Yep.
And if you call them at 2 a.m. in the morning, you're not talking to anybody. But when they're enrolled in one of our care management programs, the average patient is talking to a live human being in 30 seconds or less. That's an SLA we commit to. And if they do leave a voicemail, they're called back within 5 minutes or less on average. That's how you delight patients, that level of customer service. And by the way, they see that as a reflection of their provider, of their physician, of their health system. So now you're growing affinity, loyalty, patient satisfaction. The second thing I'll say more around clinical impact is what we have seen are practices and health systems that launch these programs perform 10 to 30% on their better on their quality measures. So it becomes a powerful tool, not just to delight your patients, but to close care gaps and to perform better on your quality measures.
Can you talk about some of the operational enhancements or efficiencies that your clients have been able to gain through partnership with ChartSpan as they develop out and further kind of evolve these programming for their members and their hospitals?
I think from an efficiency standpoint, integration is really important. So when we bring on a new customer, we're going to integrate with their EHR bidirectionally. So we're pushing the clinical data sets back and forth. So if I talk to the patient this morning, the provider knows this afternoon when they see them in the office. The other thing I would talk about is integrating on the back end so that the rev cycle and the billing department is not having to manually enter the CCM and APCM encounters like they do most encounters. Instead, we've created an innovation that automates it for them so that they can send thousands of claims to the clearinghouse. In this relationship, you're submitting claims every day, getting paid within 10 to 14 days. Our invoice doesn't show up till next month on 30 net terms. So you're paid and profitable before you ever pay our invoice. So it's a really harmonious, sensible, common sense relationship that really works well with our partners.
Yeah. Jon Michial, one of the things that I value so much about the ChartSpan partnership is It's just that because you're able to focus on something that's very specific and very deliberate. And so by having an organization like yours that is very good at a very specific area of a hospital's business, it allows you to understand longitudinally across all of your customer base what works and what doesn't, which I think is just a huge value add to hospitals in Pennsylvania that are using your program.
Well, Joe, I will tell you that since the day I started this company, we had one mantra that governed every single one of our behaviors, and it was singular in focus. Wake up every day and aspire to be the greatest care management provider in the world. We resist the temptation to add a bunch of products and services. We truly want to be the best in the world at one thing, and that's driving care management programs for Medicare patients.
So, Jon Michial, on behalf of myself and HAPevolve, I'm leaving the conversation with a much better understanding about the space than I even had coming in. For those who are watching this video, more information about Jon Michial and his team will be contained in the description below. And if you'd like to learn more about ChartSpan or its programs, please feel free to reach out to the contact information in the video, as well as any of the HAPevolve staff. We'd be happy to make a connection. So again, Jon Michial, on behalf of myself and my team, want to say thank you so much for your time and for your expertise and sharing with us a little bit of understanding today.
Grateful for the time, Joe. Thank you.